Tonight, the CDC says Americans are not being hospitalized with the Omicron variant at the same rate as other strains, but they tell us it is still dangerous, especially for children. As Meg Oliver explains, nationwide there's more than 250 pediatric COVID hospitalizations each and every day.
As the Omicron variant continues to sweep across the Northeast, unvaccinated of all ages are at increased risk. In New York State, health officials say pediatric hospitalizations in New York City rose nearly fivefold from the start of December, and almost all of the children were unvaccinated.
We need to get child vaccinations up. We need to get them higher than they are, particularly in the 5 to 11-year-old age group.
In New York State, roughly 27% of 5 to 11-year-olds are vaccinated. Nationwide, that number falls to roughly 23%. New York Presbyterian Chief Pediatrician Dr. Sally Permar.
The vaccine is so much safer than getting the virus itself. And so giving your child the vaccine keeps them safer than letting them get infected with this virus without any immunity from a vaccine.
While hospitals typically see a rise in pediatric admissions this time of year, Dr. Permar says parents should take Omicron seriously.
How serious are their symptoms?
Well, serious enough to be admitted to the hospital, which again is an indication that this is not just a disease of adults.
What do you think should happen in terms of reopening schools now that you're seeing a spike in cases among kids?
Yeah, I think we know so much more about how to keep our children safe. And we also learned how devastating it is to keep children out of school. So I think we should use all the tools we have, implement vaccination for all the school kids, also use testing, also use masks and our typical hand washing and social distancing to keep kids in school, even with this rise in cases.
New York Governor Kathy Hochul also announced she's urging all superintendents to keep their classrooms open. She says she's prepared to send any additional resources they may need to prevent any disruptions to in-person learning. Meg Oliver, CBS News, Paterson, New Jersey.
And as that Omicron variant continues to move all across the country, the CDC says how to protect kids, particularly those younger than 5 years of age, is extremely important. Tonight, a former CDC director talks about why vaccinating others can ultimately help children.
We wish we knew more. We wish we knew how severe Omicron is going to be, but we won't know that for a few weeks. We wish we were able to protect kids under age 5, but currently we don't have a vaccine for them. That's why it's so important that everyone 5 and over get vaccinated and boosted to protect all of us. Remember, over 50 American kids have been killed by COVID so far, and thousands have suffered from the inflammatory condition that rarely follows it, but can be quite severe and life-threatening. We all need to work together, and if we do that, we can prevent COVID from dominating our lives in 2022.
And he adds that the Omicron variant is a very different virus from other COVID strains, and to stay ahead of it, we need to adapt the way that we fight it.